Hey everyone, my name is Derek Corey, and I am going to present on the chronic care internship or chronic care management internship at the Rexburg Medical Center. I found this internship through the BYUI email, so I would strongly encourage everyone in marriage and family to pay attention to the emails that they get because Brother Rarick is really good at probably at least once or twice a month sending out a mass email that has a list of these amazing internship opportunities. So if you're on the look for internships, you can absolutely find them through BYUI. The process of getting this internship was I went through a couple of interviews, the first to kind of introduce myself, and then the second to sort of show why I felt like I would be a good match for the internship. Obviously, because you're working with patients face to face a lot, um, they require you, they want to make sure they're getting the right candidate. So you have to get a background check as well. Just a little tidbit of information there. The responsibilities for this internship kind of encompass a lot, which is part of the reason I liked it so much. So the first is that we would schedule checkups for chronic care patients. Now, what are chronic care patients? So at the Rexburg Medical Center, we have a program for patients who suffer from more than one chronic condition, whether that be asthma and depression or diabetes and anxiety, things like that. We want to make sure that we're treating them personally and as effectively as possible due to their specific needs. So oftentimes I'll start my day off by calling some of our chronic care patients that we haven't seen in a while and getting them in for a checkup just with the doctor to make sure everything's going okay. Number two, and perhaps my favorite responsibility, is I actually get to interview patients personally. So if we have a patient come in and they have two conditions or more, I'm the first person to see them after the nurse. I'll get in there and I'll interview them. I'll ask them a list of a bunch of different questions, depending on what they're in for, whether, again, it's diabetes, anxiety, depression, stuff like that. Now, I don't offer medical advice, obviously, but I can ask questions to sort of gauge where they are, how well they're able to take care of themselves, stuff like that. I'll I do a lot of building packets of information. One thing that we really pride ourselves in with the chronic care management team is we want our patients to be informed, and that includes the families. So we try and develop these packets that have tons and tons of information from who to contact if you're having a medical emergency to even something small like exercises you can do when you're working through diabetes, stuff like that. And these packets can range from, a little pamphlet to a whole folder filled with, dozens of papers of information. And obviously um, sorry, that's my dog. Obviously it's developed for each patient individually so that we can get them the best care. Another thing that I do is I help schedule things for providers. Again, I schedule checkups for chronic care patients, but also the providers are the doctors or the nurses that we have in the office. If they need specific help reaching out to some of these patients, they go through me. Another thing that I do occasionally is I'll meet with the families to help with the treatment. So these include guardians for younger children. So if their kid has just been diagnosed with diabetes as well as hypertension or something like that, then I'll meet with the family and help show them ways that they can help their kid. Another thing that I spend a lot of my time doing is connecting with providers around Eastern Idaho, whether that be doctors, specialists, therapy centers. And then I do a lot of following up with patients, making sure that their care is going well, making sure that they feel like they have a handle on their conditions. I mentioned it briefly, but I do actually schedule therapy appointments for patients who may not have the skills, or it's just too stressful to do that stuff for them. When you're dealing with multiple conditions, it takes a lot off your plate for someone to schedule that appointment for you. So I did a lot of that. And then lastly, I did this very rarely, but if the nurses needed help with check-ins and stuff like that, I would actually help them. I'd sort of be like a little nurse assistant. So as you can see, like I did quite a bit of things here at the Rexford Medical Center. So how I benefited the site, specifically, I created one diabetes pamphlet that will actually be circulated throughout all of Eastern Idaho at different hospitals, different centers. And it was centered on diabetes, and it included information on like recipes and exercises that you can do. So just things to help day-to-day life. I took responsibilities off the shoulders of providers. Again, doctors are really, really busy. And so me being able to step in and kind of assess where the patient's at before they take over is really helpful for them, and it saves them quite a bit of time. Number three, I helped personalize patient care. And what I mean by that is I went through a lot of our packets and informative stuff and made sure that they were being tailored to patients specifically. And it takes a lot of time, but I feel like it's more beneficial, as well as, you know, I organized a lot of the information on hand, made it more easy to find, stuff like that. How did I benefit? I learned to work in a clinic, like a medical clinic, and I learned kind of the ins and outs of that and how doctors schedule their appointments and the importance of understanding the inner workings to really benefit your patients. I was able to work face to face with clients, which for an internship is huge. And it really kind of gave me a taste of how to work with families in the future. I learned how to be more sensitive to people with chronic issues, which is something I'll talk about a little bit later. And I feel like I gained a better understanding of how to do research in the field. When you're developing information packets and stuff like that, for people with depression or diabetes, you have to be really, really careful, and you have to make sure you're giving them accurate, up-to-date information. So research is really, really stressed here. So a really quick connection between my coursework and internship, I mentioned it briefly in the last slide, but I think overall what I learned that really helped me was, I'll give an example of connecting this to my developmental psych class. So in developmental psych, you go kind of age by age group, talking about the different psychological boundaries and achievements that each age might face. And I saw this firsthand when I was doing face-to-face interviews with patients and working with patients face-to-face. And I learned very quickly, and it was a very humbling lesson, that you cannot treat a 12-year-old like a 25-year-old. You can't treat a 25-year-old like a 45-year-old. Each age group requires a different level of care, and each group you need to talk to differently in order to really foster that connection. So last, would I recommend this internship? Absolutely. It's a tough internship, and sometimes it's kind of daunting because you have to do some face-to-face contact, and that can be scary for an internship, but I loved it. Now, as far as like who students should contact, my supervisor was named Zach Wilson, and he was amazing, but he's actually overseeing the Rigby Medical Clinic now. So he's no longer at the Rexford Medical Clinic. But if you call the Rexford Medical Clinic and just ask for the patient care coordinator, that's normally the person who will oversee this internship. And that's all the information that I have for you guys today. Thanks.